Atrial fibrillation, the silent arrhythmia. Atrial fibrillation, also known as AF or AFib, is the most common type of heart rhythm disorder, affecting millions of people worldwide. Despite its prevalence, it often remains misunderstood and misdiagnosed. In this video, we will delve into the complex world of atrial fibrillation, its causes, symptoms, risks, and treatment options. Understanding atrial fibrillation. To comprehend atrial fibrillation, it is first necessary to understand how the heart works. The heart is essentially a pump with 4 chambers, 2 atria on the top and 2 ventricles at the bottom. Under normal circumstances, the atria contract to fill the ventricles with blood, which in turn pump blood to the rest of the body. This synchronized process is regulated by electrical signals that originate from the sinoatrial node, often referred to as the heart's natural pacemaker. Atrial fibrillation occurs when these electrical signals become irregular and chaotic, causing the atria to quiver or fibrillate rather than effectively contract. As a result, the ventricles may not fill completely or pump enough blood to the body, leading to various health issues. Causes and risk factors. Atrial fibrillation can be caused by numerous factors, ranging from high blood pressure and heart disease to certain medications, lung diseases, and excessive consumption of caffeine or alcohol. Age is also a significant risk factor, with the condition being more common in older adults. Symptoms and complications. The symptoms of atrial fibrillation can vary from person to person. Some individuals may experience heart palpitations, shortness of breath, weakness, or fatigue, while others may not have any symptoms at all. Consequently, it is often detected during routine medical checkups or while diagnosing another medical condition. Left untreated, atrial fibrillation can lead to serious complications. As the heart's efficiency diminishes, the risk of blood clots forming in the atria increases. These clots can travel to the brain, causing a stroke. In fact, people with atrial fibrillation are 5 times more likely to suffer a stroke. Additionally, AFib can lead to heart failure, a condition where the heart is unable to pump enough blood to meet the body's needs. Diagnosis and treatment. Diagnosis of atrial fibrillation primarily involves an electrocardiogram, ECG, a non-invasive test that records the electrical activity of the heart. In some cases, more complex tests such as an echocardiogram or a Holter monitor may be required. Once diagnosed, the treatment for atrial fibrillation aims to restore the heart's regular rhythm, prevent blood clots, and reduce the risk of stroke. This can be achieved through medications, non-surgical procedures like cardioversion, or surgical interventions such as catheter ablation or atrial appendage closure. Lifestyle changes are also crucial for managing atrial fibrillation. Regular exercise, a heart-healthy diet, moderation of alcohol and caffeine intake, and cessation of smoking can all contribute to better heart health. Conclusion: atrial fibrillation is a serious medical condition that requires prompt medical attention. Early diagnosis and effective treatment can significantly reduce the risk of complications, such as stroke and heart failure. As with many health conditions, prevention is better than cure. Therefore, maintaining a healthy lifestyle can go a long way in keeping atrial fibrillation at bay. Remember, the information provided in this video is a guideline and should not replace direct consultation with a healthcare provider. If you or a loved one experience any symptoms of atrial fibrillation, seek medical advice promptly.